Okay, so it is 7 a.m. Eastern time for me here in Boston, and I know many of you guys in this class, so it's great to see you again week after week. I see a couple new faces. So for those of you who have not met me before, my name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in the Boston area for the last 5 years. I own my own practice here, but have been also teaching with the Community Online Academy since it began back in March. So today's program is a 30-minute program on back pain and specifically how to manage back pain using a foam roller. So we're going to be almost entirely movement-based for this program. We'll do some stretching, some strengthening, a little bit of balance work, and then we'll save some time at the end for any questions that do come up. With that being said, there's a number of ways in this class, especially, that you can customize this program for you. And I do encourage you to really listen to your body and take either the modifications or the challenges that I offer to give you the best experience for this class. And I want you to leave this class feeling a little bit better than you came into this class. So we will get started today with the foam roller lengthwise. So this is where if you have a shorter foam roller, you will need to modify just a little bit. So if you can see my roller back here, it is lengthwise along the mat. We're actually going to lie down with our full spine on the roller. So the easiest way to get on and get set up in this position, I think, is to sit right on the end of the roller and then walk your hands backwards until you can lie all the way down with your spine on the roller. And you want to make sure that you have room for your head. Now, if you have a shorter roller, make sure that at least your head and your upper back are on the roller. From there, you can kind of hold your hips in a little hover, or maybe even add a pillow or two underneath your roller. So once you're in this position, just take a moment to settle in. This is kind of the first movement we've done over the course of the day for many of us. So let your back settle in. I think this can always feel a little bit funny to get started because it's really forcing us into our sort of perfect posture. It's keeping our spine all in one line. So just lie here for a moment and get in touch, get in tune with how your body feels. Notice maybe some asymmetries from side to side, where you feel more tension in one side of your body than the other, where you feel some heaviness in your tailbone, any space under your low back. Just notice that for right now. We're going to talk briefly about what a neutral spine position means, and I think the roller is a really good way to learn that. Neutral spine is your back's natural curve, and that's what I recommend doing a lot of abdominal strengthening, squatting. You want to stay in a neutral spine. So neutral spine leaves a small space under your low back, but minimal space underneath your rib cage. And I think for a lot of us, when we lie on the roller, you'll notice maybe a little bit too much space behind your rib cage. So it's not about necessarily flattening your low back into the mat, but flattening that upper to mid back. So as we lie here, think about inhaling to open up and expand your rib cage. Maybe your ribs even lift away from the roller slightly. But when you exhale, feel your ribs glide down and press into the back of the roller lightly. Good. Inhale, open up the rib cage, open sideways, and exhale. Feel the rib cage glide together and press back into the back of the roller. Now, as you're pressing down with your ribs, again, that doesn't necessarily mean your low back. So see if you can try and maintain that small space under your low back, but press the back of your rib cage down. We'll try 2 more breaths just like that. Good. And one more time here, drawing the ribs down and together, and then try and hold it like that. From here, you can open up your arms out to the side. You'll feel a nice stretch across your chest. As you continue to pull the front rib cage down, that should actually give you a little deeper stretch across your chest. And then we're going to do a little bit of light core work here. Now, if you're on the shorter roller, I'm going to have you just stay in this stretch. It's very hard to replicate this on a shorter roller. But if you have a longer roller, your whole spine is on the roller, leave the tips of your fingers down and start to gently march your legs one at a time. Okay, and your goal here is to stay nice and balanced on the roller. Now, if you've been taking this foam roller class with me a couple of times and you've done this before, you can try and lift both legs at the same time and just get your center here. Use the back of your shoulders and the back of your ribs pressing into the mat to give you stability. Maybe you even try the opposite of lowering one leg at a time. And this can be fairly advanced. So if you are new to this, just practice that little lifting. And this is looking at the stability of our spine when we do alternating leg movements, which is like walking, running, stairs, things that we do every day in our day-to-day life. And you may find one side to be much wobblier than the other side. And that's okay here. See if the back of your ribs are still down on the mat in your neutral spine position. Good. We'll do 4 more here. And 3, that's it. Last 2. And 1 more time, good. Now we're gonna come off the roller. So there's really no graceful way to do this. Just roll to the side and come up. Thankfully, you're not super high, so that shouldn't be too uncomfortable. Now, before we get into the next part of our movement class, I want to give you guys a little test so you can get a sense of what does the foam roller really do for your back. So everyone come on up to a standing position. I'll adjust my camera slightly. We're just going to take a quick look at our spine range of motion, and we'll retest this at the end of class. So I'll have you stand with your feet down flat underneath you, cross your arms across your chest. Without moving your feet, you're gonna rotate to the right, see how your body feels, come back to the center, rotate to the left, and see how your body feels. Bring your hands to your lower back. We'll test our motion leaning backwards. And then we're gonna last test our motion bending forward. And just be gentle with these. I don't want you pushing into pain or discomfort. Just test it to sort of see where your body is today. So you can run through those one more time. Notice if you feel tightness, stiffness, soreness, or pain. One of the things we think foam rolling can help with is to increase our pain-free range of motion. So let's take that back down onto the mat now. I'm gonna readjust my camera again, and this time we'll turn our foam rollers perpendicular to the mat. So this is where, once again, if you have your shorter roller, you're in good shape now. We'll be using the roller very similarly through the rest of our program. We're gonna work on our upper back first. So again, a big part of our full spine range of motion is mobility in our upper back. So you're gonna find the roller right between your shoulder blades, holding your head in your hands, and make sure you're really holding your skull, not the back of your neck. So hands are right behind the bony ridge of your skull, knees are bent, and then we're gonna end up picking our bottom up and rolling to the base of our neck and then down just below our shoulder blades. You don't wanna go too far past that point. We're staying in our upper backs for right now. As you roll here, I want you to think about that breathing technique we just did on the foam roller where we were working to press our back ribs into the mat. See if you can do that same breathing pattern here. So as we're mobilizing our upper back, we're also mobilizing our rib cage because they are connected. And so we can help to get a better, deeper stretch with the roller by using that expansive breathing pattern to open and close the rib cage as we roll. That's awesome here, guys. You may get some cracking or crunching, clicking. That's okay as long as that's pain-free here. That's actually a sign that you're getting some movement at the joint itself. And so we have a lot of joints in our back. There's the joints between the thoracic spine, our upper back, but there's also the joints where our thoracic spine and our ribs meet. And we have many of those in this region. So you may hear some movement there. Now, as you're moving, see if you find one particular spot that feels tight, and that's going to be different on everyone. That's where this class really gets customized for you. See if you can find that spot, put your bottom down, draw your rib cage down as though you're connecting it towards your hips and keeping the ribs down. See if you can drop your head and chest back over the roller. Now I'm not letting my head hang back to look at the wall behind me. I'm actually trying to keep my head just relaxed and heavy in my hands, but letting my chest drop back. And then maybe I lift up. I can do that same spot again, dropping back, trying to feel that expansive breath pattern. Or maybe I roll to a new spot and try that same thing. So this is working on thoracic extension, and that's that backwards leaning motion that we just checked in our standing position. So if that one was tight, sore, or uncomfortable for you, this is something that's probably worth working on. Now we'll add in a couple other dimensions. So we'll go back to that rolling. I'm gonna sit up to just show them to you guys, but keep rolling. As you're rolling, you can add a bend sideways to either side. You can also add rotation. Okay, so I'll go over what those look like in this setup. So as you're doing that sideways bend, it looks like pulling your right elbow towards your right hip. That opens up the left side of your body. And vice versa, you can take your left elbow towards your left hip to open up the right side of your body. And just notice if one of those sides feels different than the other. This helps you with the rotation, the twisting that we looked at. So if you found that, wow, I've got way more motion twisting to one side than the other, this is probably something you want to work on a little bit. And you will probably find that as you try these side to side movements that, wow, one side might be a little bit stiffer than the other. And so perhaps you spend a little bit more time on that side. And again, it's okay to work with the foam roller a little bit asymmetrically to give you, the focus and attention where your body needs it. Now you can also add that rotation. So one elbow up to the ceiling, the other elbow down towards the floor. That's going to get a little bit more into your lat muscle. This also helps with some of the rotation, twisting kinds of movements. Same thing, you can do that to the other side. So just checking in, seeing how the two sides feel, and maybe spending a little bit more attention on the side that feels tighter, or maybe a little bit more sensitive. You can always place your bottom down and take a rest. I know it's a lot of work for your hamstrings and glutes to hold yourself up, and just check in with your head and neck here. You don't want to be holding tension in your neck as you're doing this rolling. Make sure that your arms are really doing their work. I always like to have my elbows narrow when I do this, and that's just a personal preference, but what it does do is it keeps my shoulder blades off my back so that I can get a deeper stretch into my upper back. You can even try that. If you open up your arms, you're going to feel your shoulder blades onto your back. And then if you pull your elbows together, you'll feel them open so that the spine itself is a little bit more exposed in your rolling. We'll spend just another moment here. Good. And then we'll come all the way on up to a seated position. Now we're going to work the whole back side of our leg today, starting from our glutes, then our hamstrings, then our calves. We have a lot of nerves that exit from our lumbar spine that go all the way down the back of our legs into our feet. And so my hope is that we're going to loosen up the tissue around those nerves so that they can move a little bit better. And then we'll recheck our range of motion at the end. So starting with our glutes, you're going to sit on top of the roller. You can still keep it in this perpendicular direction. And we'll go from one side to the other. So if you picture the bony part of your bottom, that sits bone, you want to be sitting just behind it. So you're sitting kind of on the muscle instead of the bone itself. We're going to then rotate by putting our left hand down and turning your body to the left. Once you're a little bit twisted like this, you can start to roll back and forth. And as we're rolling in the glutes, your glutes should be, fairly developed muscles. You want to stay on the muscle itself, not the bone. So two bones that you want to think of being cautious around. One I mentioned to you already is that sit bone, the bottom part of your pelvis. The second is that big bone on the side of your hip, the greater trochanter. For most of us, that is the widest part of our hip. You will know when you roll over it because it's very, very uncomfortable. And that's because we have a little bursa under there. Bursa is a fat pad that is designed to prevent friction between the tendon and the bone itself. So since it's there to prevent friction, it doesn't like being foam rolled over. Good. Now, you guys can practice being a little bit more rotated or a little bit more square up towards the ceiling. And that's just going to get different parts of your glute. So we have a lot of small muscles that make up that glute complex. Different people are tight in different places. If you want to pause and spend a couple minutes on one particular spot, you can do that. You can also continue to roll back and forth over that spot. So just work within what's comfortable for your body. Check in with your shoulder at the same time. Just make sure your shoulder is not getting really compressed by your ear. We want to be sensitive to the rest of our body as we're doing this rolling. Good. You guys look great here. I get a question a lot about, what about the piriformis? This is our piriformis rolling right now. So the piriformis is kind of a diagonal muscle across the back of the glute. So if you are slightly rotated, you're going to be getting into the piriformis here. Now, to add a little bit of body weight, you can cross your right ankle on top of your left thigh, only if that feels good for your body. Some people need that extra body weight and pressure, others do not. So you want to lift the leg that is away from the body, the side you're rotated to. So keep the rotated leg down. You can also increase the body weight you feel by creeping that foot in a little bit closer to your body. Now we're going to do the same thing on the other side. So this time I'll reach my right hand back onto the floor. I'm going to lift my left arm up, turn my body very slightly to the right, and start to roll through the muscle on that right side. And you can roll down right to before that bony part of your bottom, all the way up to the top of your pelvis. So those glute muscles kind of span the length of your pelvis. So you can feel for the bones in the back of your body. You don't want to roll into your lower back here. That's starting to get more into the kidneys and our liver and things. So we want to be sensitive to some of the organs in our lower back, but also the glute muscles don't go up that high. So if we're focusing in on the glutes, they surround our pelvis and go down to the bottom of our pelvis. They are also on the sides of our hips. So like I said, you can rotate to the side, but just be sensitive to that big bone, which is the greater trochanter. It's a part of our femur, and you'll feel that on the sides of your hips. Good. If you're getting any particular spots that are really sensitive and tender, you can pause there. You can add some body weight by now crossing your left ankle on top of your right thigh. Check in with your shoulder, make sure your right shoulder is dropping away from your ear, and let yourself just breathe comfortably. Good. That's it. We'll try about 3 more just like this. That's it, good. Okay, now bring both feet back. You're gonna lift your bottom up and just roll the roller down to your hamstring muscles, which are on the back of your thighs. Now we're gonna set up a little bit differently. We're gonna start centered for this one. And this is, I think, easiest to be done up on your hands, but if your wrists are starting to get tired and sore, you can do this down on your forearms. So whatever is comfortable for you, I'm gonna start on my hands. Now, I want you to keep a soft bend in your knees, at least to get started. It's easy to straighten your legs here. Try and keep that soft bend in your knees. You're gonna roll right up to that bony part of your pelvis, the sit bones, but we're on the other side of the sit bones now. So we're not going over the bone, we'll go right up to that point, and then right down to the back of your knee. And we're not going over the knee joint, we're gonna roll just to the top of the knee, and then back out to the sit bones. So we're just starting here, assessing. Right away, you might feel more tension in one side than the other. For right now, just notice it. Your hamstring muscle is made up of 3 smaller muscles, so they kind of go across the span of the back of your leg. You can very slightly roll both of your legs to the left, and then very slightly roll both of your legs to the right to feel more of that inner part of the hamstring versus the outer part of the hamstring. Different people are going to be tight in different spots. So just notice for your body, start to get in tune and in touch with where you feel that tension. Now, again, I'll demonstrate on the forearms. If you're back like this, it's a little bit more work for your shoulders, but that's an option that you can try here. You can also simply take a rest and then come back up to your hands. Now, if you would like to add more pressure, like you feel one side needs a lot more attention, you're going to cross one leg on top of the other, and then you can still do that rolling, sort of rolling the bottom leg to the right and to the left to feel the inner versus outer part of your hamstring. Also check in sort of with that low part of your hamstring versus the part all the way up by your glutes. And I think a lot of times we don't get high enough. Your hamstring muscle actually attaches to your pelvis, that sits bone, so the bony part of your bottom. And a lot of the bulk of the muscle is up a little bit higher there. So you want to make sure that you're getting all the way up to the bony part of that pelvis, and then all the way back down into the towards the back of the knee. And for the same reason as we talked about with the bones in the pelvis when we did the glutes, we don't want to roll over the knee joint. There's a lot of bones. There's also a couple small nerves there that we want to be sensitive to, that they really don't like foam rolling. So right now we're focusing in on the muscle itself. Now, if you cross one leg over the other, go ahead and switch. You can do the opposite. I recommend having the knees softly bent here, because the sciatic nerve does run through the course of where our hamstring is, and straightening the legs in this long position could actually put a lot of stress on the nerve itself. So like I said, we're focusing more on the muscle here. Keep that soft bend in your knees. Good. We'll spend just another moment or two in this setup. And then you can go ahead and place your bottom down. We're going to stay in this setup. One more muscle group, the final one down at our calves. So push your roller down. It should be under the meaty part of your calf muscle. The length of movement we're going is to the bottom of the knee, not over the knee, and right down to your ankles. So you'll feel your Achilles tendon. That's the tendon for our calf muscle. You can go right down to the tendon, because you actually do have a deeper calf muscle behind the gastrocnemius, which is called the soleus. It goes down fairly low in towards the ankle. So hands behind you. Once again, you can be on your hands or on your forearms. Bottom lifts up. This one starts to get into a little bit of core work, because we're having to keep our hips in that hovered position off the ground. So if there was ever one to be sensitive about shoulder and neck position, this is it. So give yourself a break if needed so you can maintain good upper body position, and roll from the very bottom of your ankles down by the Achilles all the way up to the back of your knees. Just like in the hamstring, you can roll slightly to the outside by rotating both legs to the right, slightly to the inside, rotating them to the left, and feeling the difference between those two spots. You can take the stretch down to your forearms if needed, and that will look like this, keeping your butt in that low hover. Try and let your feet relax a little bit here. You can even sort of point and flex your feet to just feel differences in how that changes the stretch down at your calf muscles. And I sometimes have questions about why you bother addressing the calves. They're so far away from the back. Couple reasons here. So that nerve that I mentioned, the sciatic nerve, it also continues to branch off in a couple different ways, but run down the length of our legs into our feet. And so we can change our nerve mobility by keeping these nice and flexible. Our calves also serve a super important function for our body, especially when it comes to our back, by acting as shock absorbers. So they are the first thing to hit the ground when we walk and when we run. And so we want them to be functioning really, really well to do some of the shock absorbing so that our back experiences less impact and load throughout the day. We'll spend another couple minutes here. If you would like to do that stack of one ankle on top of the other, that's an option here. Because we're a little bit farther away, that becomes a lot more intense when you do it down in the calf. For me, I find that much too intense, but you are welcome to give that a try if you would like. One modification I have seen here, and this is a lot less pressure, is if your upper body is tired, you can put your bottom down and just kind of practice rolling your knees themselves in and out. It's a very gentle foam roll because you don't have as much body weight, but it is an option if your upper body is getting a little bit tired from the work we did earlier in our program. Good. So bending and pulling. It also doubles as a little bit of work for your hamstrings here. Nice, guys. Okay, so we're gonna give ourselves a quick break. The last muscle group we'll get into is our quad. So that's on the front of our thighs. We're gonna flip on over. And then we'll end up doing, this one I think is easiest done on the forearms. You can do it up on your hands, but I'm gonna set you guys up on your forearms to give this a try. We'll get the meaty part of our calves, our quad right on top of the roller, and then walk your forearms down. You're gonna keep your toes on the floor to start. And then we'll very gently roll right up to the bony part of the front of your pelvis, and then all the way down to the top of your knee. So just kind of rolling the length of your femur bone is going to be where our quad muscle is. The quad is 4 small muscles, and they span from the outside all the way to the inside of the femur bone. So you can do that rotation here to rotate more to the outside or the inside. You can do the leg stack here as well. So crossing one ankle on top of the other to bias your body weight more to one side or the other. You can pick your feet up here if you feel strong in your upper body to give yourself that support. Otherwise, you can kind of walk your toes forward and walk your toes backwards. So whatever you feel comfortable with here, shoulders down away from your ears, keeping your neck long, still maintaining that good upper body posture. This also doubles as some nice core work if you're thinking of lifting your rib cage away from the floor. Awesome. Good, guys. We're going to spend just another moment or two here. And my recommendation is that we spend about 1 to 2 minutes on each muscle group. So we've worked on the quads, we've worked on the glutes, then the hamstrings, then the calves. And you may find you need to spend more time on one of those than the other, and that's fine. This is just kind of an overview of how to get into all these spots. You may also find you need to spend more time on one of your legs than the other. Good. So now go ahead and press yourself on up. And we're gonna go back to those spine motions that we tried in the beginning of class. So come on up to a standing position. Ground your feet down into the floor, so look that your feet are parallel to one another. Cross your arms and go ahead, try twisting to one side. Try twisting to the other side. You can bring your hands to your lower back. This is extension, the leaning backwards. Give that leaning backwards a try. And then our last motion was to reach forward, diving down towards your toes. And I think this one for me is always the most dramatic, that I feel, wow, I can get a lot closer to the floor, one, more comfortably, but two, keeping our legs straight. So you guys are welcome to kind of retest those. Again, it's twisting to the side, it's leaning backwards, and then leaning forward, reaching towards your toes. But I hope that you can feel sort of the change in your pain-free range of motion. And one of the reasons we care about that pain-free range of motion is that the more mobility that your spine has, the more flexible and pliable it is to the different movements that we have to do throughout our days. So a really, really stiff spine can be a little bit more prone to injury in the sense that it doesn't have a lot of movement to be able to do, you know, the typical things we do in our day-to-day life. So it is under more stress in those small ranges of motion. So I want to just save our last minute or two of class doing any Q&A that you guys have, any questions you want to go over, special requests for future classes. I'd be happy to answer and address those things. And since you guys are the nice small group here for our 5-star, feel free to unmute yourself, or you can write to me questions in the chat. So just more of a comment here. For the first time ever using your foam roller, I have a comment that was quite painful. That is normal, I would say, for the first time you're doing this. And I think for those of you guys who have taken my class a couple of times, you know it does get easier, it does get a little bit better. But it definitely can be eye-opening the first time you do some foam rolling as to where those tight zones are for your body. But I hope you're feeling a little bit better after working that out. Any other questions I can answer for you guys?